What is ulcer surgery for perforation? Have you ever wondered what happens when a peptic ulcer becomes so severe that it creates a hole in the stomach or duodenum? This condition is known as a perforated peptic ulcer, and it is a medical emergency. When this occurs, the contents of the stomach can leak into the abdominal cavity, leading to serious infections and inflammation, a condition called peritonitis. Ulcer surgery for perforation is a critical procedure aimed at addressing this life-threatening situation. The primary goal of this surgery is to close the hole in the ulcer to prevent further leakage and to clean the abdominal cavity to reduce the risk of infection. There are several surgical techniques that surgeons may use. One common method is primary closure by interrupted sutures, where the surgeon sews the edges of the perforation together. Another technique is the omental patch repair, also known as the Graham patch, where a piece of the omentum, a fatty tissue in the abdomen, is used to cover the perforation. This helps reinforce the closure and promotes healing. There is also the Cellan repair, which is similar to the omental patch but involves leaving the omentum attached at one end. Before the surgery begins, the abdominal cavity is thoroughly washed with saline to remove any contamination from leaked gastric contents. In recent years, minimally invasive surgery, also known as laparoscopic surgery, has gained popularity for repairing perforated peptic ulcers. This technique uses small incisions and specialized instruments, allowing for faster recovery and fewer complications compared to traditional open surgery. Patients typically receive supportive care before the operation. This includes fluid resuscitation to stabilize their condition, placement of a nasogastric tube to decompress the stomach, acid suppression therapy to reduce stomach acid, and antibiotics to control any potential infection. The choice of surgical technique and the timing of the surgery depend on several factors. These include the size of the perforation, the condition of the surrounding tissue, the patient's overall stability, and the expertise of the surgical team. For larger perforations or fragile tissue, an omental patch repair may be more beneficial. Despite advancements in surgical techniques and medical management, surgery for a perforated peptic ulcer carries significant risks. These can include post-operative leaks, infections, and even mortality, especially if treatment is delayed. Therefore, prompt surgical intervention combined with appropriate medical therapy remains the standard of care for this serious complication of peptic ulcer disease. Always consult with a healthcare professional for personalized medical advice regarding this condition.